because my next guest, I've been looking forward to speaking with him for some time. I've spoken with him in the past. He did actually feature in my documentary, even though he's a very busy man and he probably doesn't remember that. But welcome back to the Freeman Report, Dr. Peter McCullough.
Thank you.
Now, Peter, what I thought we'd do today, rather than kind of go down any specific rabbit holes on COVID, I thought I would... There's lots of questions, unresolved questions still flying about. So I've got a number of them, and they're all questions that have been put to me by people who watch the show. So I thought I'd fire them away and we'll see how many we can get through in the next sort of 15, 16 minutes. So, Peter, I guess my first question is, do you agree with Professor David Hughes of Lincoln University that COVID was a pre-planned event?
There was a tremendous pre-planning for a coronavirus pandemic. Peter Breggin, COVID-19 and the Global Predators, outlined since 2012, 36 pandemic preparedness planning events, 25 were documented and 6 were filmed. So there was great anticipation of what was going to happen. It was a created virus, U.S.-Chinese collaboration. I think the final issue is, was it intentionally released or did it accidentally come out of the lab in Wuhan?
Yeah, I guess kind of what David Hughes is alluding to. He says that actually COVID itself, not necessarily being prepared for a virus which might or might not come at some point. His view is that the whole thing, the pandemic, as a lot of people call it, was planned very, very meticulously for 2 decades. Mm-hmm. What are your thoughts on that? Do you give that any credence at all?
Yeah, I would agree with that. If you date it back to the 2005 U.S. PrEP Act, I would agree with that.
So, do you want to elaborate on that then? So, what I mean, I guess the question that falls, the first question falls out that is, if it was a planned event, COVID itself. I'm not talking about the preparedness and the plans that were put in place after it was clear that there was a virus, or we were told it was a virus. But the accusation is that the whole thing, the fact, the release of COVID, the manufacture of it, the fact that we would have a pandemic in the first place, that it's all just a planned event. If you agree with that, what do you want to elaborate on that? Who has planned it, and what are your thoughts on that?
Well, in 2005, Congress and HHS in the United States wrote the PrEP Act. It said there will be pandemics, and when they occur, there will be government countermeasures which will have immunity from liability. In 2017, Johns Hopkins and Bloomberg School of Public Health, Gates Foundation said there will be a coronavirus pandemic, and when there is, there's going to be an organization of social and major media to railroad mass vaccination on the world. And then in 2019, Event 201 happened, and prominent members attended, and this was filmed, including Avril Haines, who's a former World Economic Forum operative. She's now our U.S. Director of National Intelligence, the Chinese CDC Director, George Gao. And they said, yes, there will be an imminent coronavirus pandemic, and then we will cover up the laboratory origins and, again, railroad mass vaccination. So I think these are very clear, video, documented, written evidence that this was all planned.
And can I just so there's no doubt whatsoever, do you agree that, like I said, I'm not sort of talking about the fact that it was planned, that they thought a virus would come of natural. I'm talking about actually, something more sinister than that, of actually, well, we're going to have a pandemic. This is what we're going to do. We're going to create this virus. Because there is a distinction there. And I'm just wondering which side of that line you sit.
It's in pieces. So the Anthony Fauci, Ralph Baric, Peter Daszak, Xingling Li creation of SARS-CoV-2 is well documented and memorialized in publications. 2015 and 2016, Nature Medicine precedes the National Academy of Science. They said they've created a SARS-like Wuhan Institute of Virology 1 virus that's poised for human emergence. The events I just documented says that it's going to happen. It's going to happen. Event 201 actually had a segment about a sense how to conceal the laboratory cover-up. That was Avril Haines and George Gao's segment in it. So it's all pieced together as a plandemic, if you will. I think that the final question is it intentionally released from the lab, or was it simply all anticipation of an accident sooner or later?
Yeah, and I guess we might never know the answer to that question. Do you think it's weird that Bill Gates declared a COVID-19 pandemic before the WHO? Because on the 28th of February 2020, in the New England Journal of Medicine, Bill Gates was the author of an article titled "Responding to COVID-19, a once-in-a-century pandemic." That was published on the 28th of February 2020. What do you make of that?
Gates Foundation hosted, with Bloomberg School of Public Health, the 2017 SPARS pandemic exercise. So Gates was in on the planning of this. So when coronavirus 19, in COVID-19 virus was circulating, it was easy for him to make the call that, yeah, this is it. This is what we've been waiting for.
Okay. And in recent days, we've heard via an official CDC FOIA response that confirms that the validation of the SARS-CoV-2 genome has not been completed actually to scientific standards. I mean, do you think this could be why we saw such a high rate of false positives? For example, 60 to 70% positivity rates in New York City, and that's a quote by Jessica Hockett. What are your thoughts on that?
The testing of SARS-CoV-2 really went in the wrong direction as the cycle thresholds were increased by the manufacturers. If the manufacturers like Roche and Abbott and the other companies, if they would have held to the CDC standard of a cycle threshold less than 28, we would have had far more true positives than false positives. And then if we would have gotten to confirmatory testing, that is doing antigen and PCR testing, we would have gotten to the actual cases. Of course, they needed to be adjudicated. Everything that happened with testing worked to falsely inflate the case count.
Yeah. I mean, do you think the PCR test itself has any use at all? Because clearly, I think you've just stated it as fact there, that which is what many of us already know, that it was abused. The cycle levels were far too high. And of course, you can find anything with these PCR tests. Do you think they serve any purpose whatsoever?
We use PCR testing broadly in medicine. And again, it's a tool, got to keep the cycle thresholds low. And then we have to validate. So we had antigen testing shortly after PCR testing. Then we have clinical adjudication. So it has a role, but it has to be used responsibly.
And what is the debate around that at the moment? Because this was a big part of the, the COVID era, was the reporting of it. And of course, it was the cases, the fact that people were said that, you could be, have not show any symptoms and still be a threat. And that was all based around the PCR test. What is the debate at the moment in America about PCR testing and its role in the COVID pandemic?
It's largely been abandoned. I haven't ordered a PCR test for COVID-19 in well over a year. It's now like the common cold. We don't talk about it much. I think it's really a black mark in this area of in vitro diagnostics. It could have been, I think, more responsibly used for sure. Remember, it's just looking at primers, little segments of code. We have full genomic sequencing. Two very good studies demonstrated that the virus is not spread asymptomatically. No illness is spread asymptomatically. It's always symptomatic person to susceptible.
And is that, do you think, because, it was the first sort of global, I wouldn't say pandemic, but it was the first time globally that we'd been told as the public that, you could be a danger to other people, but not have any symptoms. Where is the debate on that now? Do you think we've learned the lesson that actually, what you've just said, that if you're not showing symptoms, actually you're not a threat?
It's been dropped because the quarantine period was dropped from 14 days and reduced. Now it's 5 days. Now it's just go back to work if you don't really have much in the way of symptoms at all. No quarantine for asymptomatic people who are exposed. We're to a point now where this is no different than any other respiratory illness. Our CDC says we only need to wear a mask when we go into respiratory isolation, like we would with tuberculosis or another respiratory illness. And it's largely just to avoid large droplet spread and actually avoid us superimposed, an unintentional cough or sneeze and have us spread staphylococcal organisms, which are common in healthcare workers in the nose, causing a secondary bacterial infection to a vulnerable person. So we're back to what we did before the pandemic. We should have never expanded masking beyond that, and we should never have extended testing beyond testing when we think there is a possible case. This idea of testing before we go on travel, testing routinely, all of that was beyond the norms of diagnostic testing. It was a giant misadventure.
What did you think? Because what you've said there, I mean, do you think if we'd taken that approach in the first place, and because there's a lot of people who say that a lot of the protocols that were put in place, including the public orders about, being locked up in your house, wearing masks and all of this kind of stuff, and then, of course, the ventilators in hospitals, that it was actually the protocols which caused a lot of the death and actually COVID itself. Now, there is a counter argument to that the first variant of COVID, the original one, was the dangerous one. And since then, it's become a more manageable disease. Where do you sit on that kind of paradigm?
Well, the first versions, the wild type and the alpha strain, were certainly more severe. We have a paper by Daniels and colleagues in JAMA. 30% of young people got COVID in the first year. 30%. So as the virus mutated, became milder, people developed natural immunity. The vaccine had no effect at all because by that time, the illness was far milder. And all we really needed to do from the very beginning is just protect the vulnerable. So I think in the United States, we had about 2.7 million nursing home congregate living individuals who are susceptible. If we just would have followed the Great Barrington Declaration, we would have been fine. Never should have locked down, should have had the economies roll through. We should have had doctors calling the shots and not government officials.
Yeah, bravo. That's exactly what I think. Now, Professor Ian Brighthope from Australia says zinc, vitamin D and vitamin C should be right next to the salt and pepper in the kitchen. Do you agree with him? And would you add anything to that?
If we've learned anything, that it's that these various forms of vitamins and micronutrients are essential. And I do agree with that. Vitamin D recommendations in my practice now are 10,000 units of vitamin D a day. And then the McCullough protocol, which is the most widely used COVID treatment protocol in the world, we go up to 20,000 units a day for 5 to 30 days. Some even go higher. So vitamin D at higher levels is therapeutic. Every study has been positive for vitamin D in terms of reducing the frequency, severity, and even the mortality in COVID-19. Zinc plays a role, I think, in the acutely ill, as well as vitamin C.
And I have got, like I said, a list of questions here from viewers, but there are two that I definitely want to ask. The first is, do you think because of course, we saw an awful lot of doctors stand up against the COVID narrative. Some have become world famous through this period. Do you think there are any doctors in the freedom movement who are using it purely to make money?
There may be some. I was a well-known physician before the pandemic. I had given grand rounds in virtually every major hospital in the United States, almost every major hospital in Australia. People knew me very well. There were some people who just came out of nowhere, had never heard them before, and made some type of claim that they had some attachment to the vaccine or something, and then they had sudden fame. So I think one of the things to do is just go back in history just a few years, and you can sort them out.
Okay, thank you. And this is a really important one, I think. and it's to do with long COVID. Because look, we don't have long measles. So, I mean, do you think long COVID really exists? I guess is the first question.
Yeah, I do. Long COVID is a real syndrome. It's due to the spike protein. We found out that the spike protein from the illness, and certainly from the vaccine, which superloads the body with spike protein, the body can't degrade the spike protein. It stays in the body. It's found in tissues, blood vessels. It causes blood clotting, nerve damage. It is the cause of long COVID syndrome. And in fact, we need to do something about it. And the most widely used approach is McCullough protocol base spike protein detoxification.
What about accusations that we didn't see any long COVID during 2020, and it only really became a thing after December 2020? And there's a lot of people that are saying, actually, this isn't long COVID. This is actually long-term effects from the vaccines, so damage and harms produced by the vaccines. What would you say to that? And I guess, you know, if you do believe that, well, clearly you do, that long COVID exists, do you think that actually there could be a lot of long COVID diagnoses which are actually vaccine harms?
The long COVID did exist in 2020. It was well described in the medical literature, particularly in severe cases, hospitalized cases. But a paper by De Axner and colleagues from Germany, 48,000 Germans, has really nailed this down. 70% of long COVID today is actually all due to the vaccines.
70%?
Yeah.
Fantastic. I'm really sorry we have run out. I've got a whole list of other questions for you, Peter, but thank you so much for joining me on the Freeman Report. Please do come back again soon. Dr. Peter McCullough, ladies and gentlemen, thank you. Right, that's it for me today. I'll be back tomorrow to do it all again. So see you then right here on TNT.